this was an important clinical question. Leukemia doctors or hematologists ask. Both of these treatment options are approved for frontline patients, older patients with leukemia. CPX-351 or liposomal daunorubicin and Cytarabine is an intensive chemotherapy, and HMA and Venetoclax is what we call relatively lower intensity. I wouldn't call it very low intensity as well, but both of these are approved in older patients. And in theory, HMA and Venetoclax is approved for patients who are not eligible for intensive chemotherapy. But because fitness is such a moving goal and sort of difficult to define, we see clinically that HMA Venetoclax is being used even in fit patients, particularly those who have adverse biology. So we wanted to compare these two, treatment options and see if there was any difference. We did this by looking at chart review from 4 large academic institutions in the U.S., including Weill Cornell, Memorial Sloan Kettering, Moffitt, and Northwestern. And we found approximately about 200 on both sides treated with either of these agents as frontline. We focused on the 60 to 75 age group because that's where the overlap of sort of these treatment groups was. And we found that there was overall no difference in complete remission rates or overall survival among patients who received either of these treatments, except caveat being the TP53 mutated patients where there was an advantage to there was an advantage favoring CPX-351. These patients who got CPX-351 seemed to have a better survival. This may be linked to a higher rate of transplant in the CPX-351 group compared to the HMA Venetoclax group, because a number of people, the transplanted CPX-351 patients got transplanted at nearly double the rates than HMA Venetoclax patient. And that's a very interesting sort of observation that in similar age, groups, one group is being transplanted more versus the other. So we are looking at now comorbidity data to understand these differences as to why, patients are being chosen one versus the other treatments, or why the CPX group is being transplanted more than the HMA Venetoclax group. So this was very interesting, findings from this abstract.